we've gone into 2020, so a very happy new year to everybody. Again, a big thank you to people who worked over the festive period, and hope that everybody, in whatever way, managed to get themselves a break and some quality time with family and friends. So we've gone into the new year with significant things happening again. Lots of developments, but some good things to celebrate as well. So from the first perspective, CQC have been back and visited us in January. We expected this. The notices that we had from CQC asked us to make improvements by the end of December, and so they were planning, they needed to come back and to see the improvements we've made. So they've been back recently to the Harbour at Blackpool, and particularly looked at our places of safety and to see how we're supporting service users to make sure they don't have long waits in our places of safety. So really well done to our teams in places of safety who gave a lot of confidence to the CQC. We're able to talk very well about all the improvements they've been based in. They've led. And when we look back, we've moved from in April, where 70% of service users coming through the places of safety were waiting over 24 hours, to now just 17%. So that is the most enormous improvement, and a massive thank you to everybody. Now, we've still got 17% of people that are waiting too long, and mostly the reasons for that now are beds. And obviously we've got the beds that are being built now at Preston that are on track, and we've got new beds that we're just developing business cases for in the Westham area in Fylde, which will be about 6 to 9 months from April. So towards the end of the year. So we're still going to have some challenges, but I know that the teams are working really very, very hard. So thank you to everybody around that. We're also expecting the CQC to come back any time now and look at our mental health acute wards and review with the teams the progress that you've all been making. So again, thank you, and please get yourselves as prepared as possible. I'm sure you all are. And work as a team to share with the CQC the great progress that you've been making. So well done. From a system perspective, just a couple of things I wanted to update on. Firstly, we've got a new Commissioner of Mental Health and Learning Disability Services, and that's Peter Tinston. Peter comes from the system, he's on secondment from one of the CCGs, and is very welcome, and somebody that we feel we can work well with and develop a good relationship. So that's really good news. And also, just to update that in the next week, we've got a couple of executive team meetings, executive to executive, with 2 of our key partners. Really important for us to have and develop strong partnerships across the whole of the system. So this is one of the ways that we're doing that. So we've got next Monday, we've got an executive to executive meeting with Lancashire County Council. Lots of ways that we are and we can partner more going forward. So we're really going to explore that. And secondly, with Mersey Care. And again, lots of ways that we are and we can partner more going forward. So I'll update you as we go forward. The other thing I just wanted to quickly mention, importantly, is all the work that everybody's been engaged in terms of our locality structure. We have now, having engaged extensively, and we've got various models, 3 clinical models and 3 leadership models, are going to be taking those to the board the week after next. And then after that, we'll be able to start to progress implementation. So again, please keep connected with the work. I've asked Lisa and the team now to start to work with service managers and care group managers around what the next tiers of the structure might look like. And so people are really involved in co-producing that. So thank you for all that work. And then importantly, we've also been developing, partly through LIA and partly through the board and the senior team, our vision and values and our new strategy. So our values have been developed through the listening into action process. Lots and lots of people have been engaged in that. So really pleased that those are emerging now. And the 4 that are emerging are that we show kindness, that we show respect with each other, that we learn and improve, and that we work in teams. So thank you. I think they're the ones that we're going to be taking forward, and asking the LIA group now to start to develop behaviours around what will those behaviours look like. And then we need to start embedding them in everything that we do. We've also spent some time developing our vision and our future strategy. And the comms team are going to send round to everybody the opportunity to share your thoughts and views on those. There's 2 or 3 options of each of them, and we'd really like to hear your views as to which ones we should go with. We've just done that this morning with our senior leaders in our Engage group, and it was really very helpful. So please, if you get a moment, just have a quick look at that and give us your thoughts and ideas. Another good news story, we've made a decision for a very small extra amount of money that the whole of the trust, everybody that works for the trust, will now have access to the Health Service Journal. So this is something that you may find helpful, certainly from a leadership point of view. I think a lot of people find it helpful to really keep abreast, be able to share and update it on lots of innovations that are happening and lots of news in the NHS across the system nationally. So hopefully that's something that you'll find helpful. The comms team will be sharing with you the details of how you can access that going forward. And then our flu rates, just a quick update about that. We only have, as of yesterday, hopefully it's come down this morning, but as of yesterday we had 124 more people that we needed to vaccinate to reach our target. I don't think I need to rehearse why it's really important. I just need to remind people that if we hit our target, it's attached to a financial amount of money, that if we don't, it basically means we've got to take money out of services. So anything anybody can do, if you've had a vaccination elsewhere for your GP or pharmacy, please can you let the flu team know that they can still record that you've had that, and that will help towards the target. If you haven't had your flu jab, you can spread the message across your teams, then please do that. A couple of celebrations. Firstly, the eating disorder all-age team have had a quality review by the Quality Network for Community Children's Services, and they've had really strong performance that's been picked up. I think in all domains but one they got over 90%, and in the other one they got nearly 90%. So really well done for yourselves. And also the Central Lancashire Moving Well Service have just won an award from the British Society of Rheumatologists. So again, really well done. So that's the end of my just headline update. I'm now going to ask Laura and Laura to just introduce themselves in terms of the role that they've got at the moment with this trying to help to develop our culture so that we don't have a blame culture.
Hi, so I'm Laura Walsh, Interim Deputy Head of Ops for the Mental Health Network, and I did have to think about that. And I am the operational lead for the LIA Workstream.
I'm Laura Holdcroft, and I'm clinical lead for listening into action.
And we also have 3 people who aren't with us today.
Yes, we do.
We just say who they are.
Yes, so we've got Margaret Jenkins, who's our nurse lead, who's the lead nurse for Lancaster and Morecambe. And she's jointly the professional lead with Maggie Kiley, a psychologist, and our medic lead is Elizabeth McPhee.
Okay, fabulous. And sadly, they couldn't be with us because of clinic. One's on annual leave and other clinical responsibilities. But you'll be talking about the work that you're all doing collectively.
Yes.
Okay, so we set off to do this because we heard loud and clear from people that this was a really important issue for us, and people felt that the culture at the moment that wasn't focused on learning enough and wasn't focused enough on systems and processes, and was focusing, I think, too much on individual and personal blame for people.
Yeah.
Now, I think you've set yourselves 3 priorities. Can we just hear a little bit about those 3, Laura? And of course, you're both Laura, so when I say Laura, anybody can answer.
So the 3 priorities that we've set, the first one is to pilot safety huddles. And that's already started up at the Orchard, and we're just identifying a second pilot site within the Community Wellbeing Network. The second priority is around exploring what just culture is across the NHS, where there's really good practice, what's great, what can we bring to Lancashire and South Cumbria, because it's not a lift and shift, it's what will work for us. And our third priority is looking at the serious investigation process and looking at the process and the feedback from staff around how that's felt, what could be done better, and then developing from there.
Okay, great. So Laura, I'm going to ask you, because you're a matron by background and you're currently now in a senior nurse role as well. So, and I've heard quite consistently since I've arrived around the serious incident process and how people feel that we haven't got that quite right. You just tell us, particularly from your clinical perspective and LIA, how you think the culture is now, and a little bit more about what we're aiming to do going forward.
Yeah, sure. I think from my own personal experience, I do think that the SI process is getting better. I do think that there is more support available for staff. However, saying that, I think we've still got quite a long way to go with that. And part of our third priority for this group is something that I'm really passionate about, around how we support staff from the time that an incident occurs all the way through an SI process and then through coroner's court if indeed it does go to coroner's court. And I think it's really, really important to make sure that staff feel very supported and ensure that that doesn't impact on their well-being and patient care.
So what are some of the things that we're hearing from staff? Because we did have a big conversation around this, didn't we? And I certainly was there and heard where we hadn't quite got it right. But I think particularly when people are in the coroners, that they didn't feel necessarily as supported as they could do. So what are some of the things that we're hearing, and what are we going to do?
That's a good question. I think the feedback, we've had lots of feedback around language, what language is used. So why did that go wrong? Looking at individuals rather than looking at actually, does the policy support staff to do the right thing? And sometimes they just don't join together. I think there's some of the feedback that we've had recently is around that repeatedly ask the same questions, and it's interesting because our patients feed this back as well, this repeated assessment process. So we understand how scary it is and going through a serious investigation process and being interviewed, but then to be interviewed or to be asked the same questions again, I think the feedback from staff is that that's not quite comfortable. Okay. And that they are in a process which is almost perfunctory rather than human
focus.
Yeah.
So from the minute, so it's traumatic, the fact there's a serious incident in the first place. Member of the team that really, if we've got it right, should be focusing on were the systems, were the processes, was the policy that went wrong.
Yes.
And we sometimes are focusing on the individual. Yes. And so they feel that the process almost feels like an investigation, that they've done something wrong.
Yes.
Before they've even started, they're worried, they're nervous. And then not only that, we're asking them sometimes to repeat the information they've already given.
Yeah, and sometimes really upsetting cases. So, going over the same thing can be really traumatic.
Because I'm sure teams themselves, when there's been a serious incident, are traumatised because they'll have personal relationships often with an individual as well, won't they?
Yeah.
So, sorry, Laura.
Some staff fed back as well that they would sometimes receive a request for a coroner's statement from somebody in the legal team or the SI team, and they weren't actually aware that there had been an incident, if it was a patient in the community, or that would be required. And staff fed back that they found that quite distressing as well.
So again, it's communication, it's leadership, it's thinking about the human and the individual within that.
Well, I think it's about tying things together. So this happens quite a lot, and you absolutely can understand where it comes from. We're asking people for statements because we need to provide them, but we're perhaps not involving the service manager or the care group manager who can know what's going on and support people through that and say, well, actually, come out of practice, let's sit together. Have you done one before? To give that real support, because quite often the managers aren't aware that the staff have been asked to do this.
Yeah, so there's a coaching approach,
Yes,
and making sure it's just not that there's a wraparound support for the individual.
It's not a cold call.
Are we going off to see other trusts that might have cracked this a bit more?
Well, I think we've absolutely looked at Merseycare, our neighbour, who they've done a great piece of work around just culture, and it's all on YouTube, and done the work with Sidney Decker. So we've looked at that.
Just for people to know who's Sidney Decker.
So he's written a well-known book around just culture, and he'd worked with the Merseycare execs around how they were going to approach previous cases and the feeling amongst staff around exactly what we're talking about now, investigations, feeling blamed, and actually repairing some of the damage that had been done. Okay. And we're looking at other areas of the country currently. We've not currently scoped. It's not as formal as you would expect. I think Merseycare have done something that's quite tangible that you can see. Other areas are doing pockets, so we're looking at what's worked well in other areas and what could work well for us.
Yeah, because there's different ways of investigating, and that can be done more on a team basis, can't it?
Yeah.
More of a learning focus.
Yeah.
Okay, great. So I can see already that there's lots of overlap between your priority for just culture and exploring that and serious incident processes.
Yeah.
That's brilliant. Now tell us a little bit more about the safety huddle.
Okay, so I feel really awful. Margaret has done a great piece of work. She's really led on this, and she's implemented safety huddles up at the Orchard in Lancaster for a 3-month pilot, working with our QI colleagues to measure the success of it. And what it involves is at 12:30 every day, the team get around a board, a TV screen similar to this. They pull up Nerve Centre, which is where we have all the patient information, their observations, whether they're on leave, etc. And they talk through the patients in a handover. Everyone's involved and everyone's encouraged to contribute. So they're looking at things such as their observations, their risk level, physical health, diet and fluid, pressure area care, so that whole patient approach, so everyone knows what's going on, what needs to be done. And as I say, QI are measuring that, but we're looking at a non-mental health inpatient unit site to pilot to do the comparison, because it's about including all members of the team for that patient care.
Okay, brilliant. And that's been piloted at the moment. Internal to the trust of physical health care.
Yes, and Margaret's come up with some principles of what a good safety huddle looks like, and has linked them to the NMC priorities as well for registered staff, which is really good.
Okay. So I think we've got some questions that have come in, have we?
We have indeed, Caroline. I'm just going to ask you we've got quite a few in actually today, so if I can just take them as they came in. So, talk about blame culture. We started off, that's obviously what this programme's about. So, Flea, sure that's not his real name, but I said, will the blame culture which currently exists in the LCFT ever be eradicated?
Okay, good question. So I hope that what you can see is we're trying to put as much effort as we can, resources, and get as many people as we can involved in this. And I guess it takes all of us to really want that to happen. I hope, I'm not sure whether eradicate, because it's human behaviours, but I hope we'll see a significant shift in people feeling much more safe, and much, when something goes wrong, we should be focusing on very much, the first thing should be the system. What's the learning as a system? How did we get that wrong in the first place? And then we can much more focus on learning. If we're focusing on the system, we're more likely to get things right next time. Focus on an individual, people won't be open, speak out, and the personal impact for them will be negative. Thoughts and views, Laura's.
Sorry, Laura.
It's okay.
Carry on talking. I think one of the questions that I've been asked repeatedly is, this is an LIA 20-week work stream around just culture. How are you going to fix a just culture? Well, we're not in 20 weeks. That's the reality. But we're starting this long journey, because this is a culture change in effect around just culture. And actually, if we can get the principles right and apply it to everything we're doing, we can then start seeing that shift.
Yeah. And I'm hoping, I don't know, Laura, from your perspective as in your LIA hat on, that some of these programmes won't finish at 20 weeks. We might decide we're going to run them for another 20 weeks, and this might be one of the ones that we do.
Yeah, so I think there's already some conversations with Ursula around very much some of these 15 topics that we've had have been the start of a really long journey, and how we best continue that work. The other thing that I would say is that our sponsor group isn't huge in numbers for eliminating blame, and we do meet fortnightly. There is a Skype option, and people don't have to attend every meeting, but I would really, really encourage whoever submitted that question and other people that are interested to come along and join us, because this is absolutely everybody's business. And
Fab. So real call to action.
Yeah.
How do they know when you're meeting? Where's the information?
they can email the listening into action inbox, or they could email myself or Laura directly, and we'll forward all of the invites to them.
Okay. Do we have sponsor group information on our website anywhere so that people can just click on and keep it up to date when the dates are?
Yeah, so the sponsor group information is all on the intranet. I'm not sure the individual dates for the fortnightly meetings are on there, but we can certainly upload
Have a
those.
look at that. That might be good. Then people can just see how they can. But please, if there's been lots of questions today, that's great. So please try and get engaged. Have we got another?
We have. So this is from Fia. We'd like to know, clinical governance and de-risking are essential. How can we justify cutting corners in relation to this, because it delays, for example, digital improvements, health, IT, etc.
Don't quite understand that, Stuart. Sorry.
I don't. I'm sorry. I'm just trying
Does
to make
anybody
some
else
sense.
understand it? Let's have one more go at trying to understand it,
So
and if not, we might have to let you know.
Yeah, so Theo, if you could maybe rephrase it. So clinical governance and de-risking are essential.
And de-risking.
Yes, are
Right.
essential. How can we justify cutting corners in relation to this, because it delays, for example, digital improvements, health, IT, etc.
Okay. So I think that's something about having This is really, really essential. The way we have a culture around low blame to achieving really good quality care, and clinical governance is part of that. And I think what we're not wanting to do is to justify that there's any cutting of any corners. I suspect that the culture has developed because people have tried to enhance governance, enhance procedure, and I imagine that we've got into individual accountability for serious incidents, rather than really thinking more broadly. But people probably have tackled that with the intention that they thought they were doing the right thing. So it's absolutely essential that we have good governance, but that good governance should, and hopefully will in the future, I'm sure it is currently in a lot of areas, focus on how we're learning and improving. And that's exactly what we're trying to do.
Right, Kaylee's quite a long question, so bear with me. Caroline, can you please confirm that you're aware of the 7 principles of public office/life, aka the Nolan principles? They are normally on the gov.uk website for anybody who doesn't know what they are. All public servants and officials are bound to adhere to them. Please can you tell us how often staff members are reminded of these principles?
Great question, and thank you for that. So the Nolan principles are 7 principles, like we said, that have been set out for how we behave as public servants. So I can't describe them all. There's selflessness is one, accountability, leadership, integrity. So I think it's a good question, and it's certainly one that I will go back. And I think as we're starting particularly to create the new world in our new locality structure, it's a good question to say how we're reflecting on those. And because we're in the process at the moment of co-producing a leadership development programme for people for that new world, and actually the Nolan principles could be focused on that. I need to understand that they're part of our job descriptions. So great question, and thank you very much for that.
Thank you. Just 2 more, if you've got time. It's I think this is more of a statement than a question, but I'll read it to you anyway. Psychological safety and staff feeling safe to say the truth without fear of reprisals or being put on a project needs a lot of work. There's no question mark after that, but I guess that's fairly true.
Yeah, absolutely. I think that's probably what Laura and Laura have
have just been saying, we've got to start somewhere, and hence why we've started with listening into action. The whole process is there to engage as many people and for clinicians and the frontline staff to be involved in making the improvements. But leaders throughout the organisation have got to then live those improvements in values and behaviours. We've talked about that this morning, actually, in our Engage. And it's a start. To change cultures can take, 5 years. But we've got to start somewhere. And actually, I'm really delighted to hear that we're going out and looking at other trusts as well and bringing that learning back. So, yeah.
And just one more. We are still hierarchically, perhaps it's that all morning as well, we are still hierarchically driven. How do more junior members of staff challenge poor behaviours when they observe these being exhibited by more senior leaders?
Yeah, so great question. So again, we've talked about this at Engage this morning. I think it's really important that we've developed the new values with staff and staff themselves through the Listening into Action group led by 3 clinicians are going to be developing the behaviours. We then need to start to really live and embed those behaviours and create the cultures where we encourage those and where people can challenge where those behaviours aren't being lived. I think going forward, what I'm really keen to see is how we can build these into our appraisal processes so that we have certain tools that test those out as well. We embed them into our training and education, our induction processes, our HR processes, so that, again, a bit like the previous question, this isn't going to happen overnight. It's going to take us a while to embed our values and behaviours into the way we do things around here. But it'll be a key, massive ingredient for us to become a really excellent place. Anything you guys want to say about that?
You think you covered it, Caroline?
I agree, yeah.
Do you agree?
Yes. Yes.
The answer's yes.
Yes.
You don't have to agree. Yeah, absolutely. And I guess there's just something about how do people, we can talk from your personal experiences, do people feel not able to speak up, do you think, when maybe they observe behaviours that aren't aligned with the values that they aspire to? Or do you observe where people have done that?
I think just going back to a piece of work that's being done at the Harbour, I think we can sometimes really quickly forget how difficult it is to raise your head above the parapet and say, I'm not happy with that, or that doesn't feel right. And, some people are quite happy being vocal, but it is difficult. So we received quite a lot of feedback at the Harbour, a lot of it anonymous. And they started small with a coffee and a chat, come as a group, that safety of your peers and your colleagues around you. And let's talk about what we're doing, what's been going on. Because I think the communication is key. I think that we're doing so much so quickly.
Yes.
We can sometimes miss that key piece of information to send to staff, and it's almost as though we're doing things in secret and not sharing it. So I think the more we're talking and having these open forums, I think it can encourage people to feel that they can safely raise
No,
things.
that's great. And then we've also got the Freedom to Speak Up Guardian, and I know Ken as our new Guardian, that dedicated role now is developing and supporting champions as well. And I know we've had just a recent example where a team went to speak to Ken and raised an issue around, very much a speaking up issue, around values and behaviours that's now prompted quite a significant work that's looking at that and seeing how we can improve. So there are examples now emerging where people's feedback are resulting in action from leadership. Okay, I'm probably now going to ask you if you've got any final points that you want to make at all.
Other than to echo what Laura said, the more people that join us on this just and learning culture development, the better, because this is about making conditions right for everybody in the organisation.
Really great. And you'll kindly put those dates on the
On the
website,
intranet,
Laura,
yeah.
So that people can engage. Please get involved and help to make this a better place. Thank you very much, folks.
Thank you, Caroline. Just a reminder, recording of this will be available the next day or so as well, so you'll we'll be able to watch you back on demand. Thank you very much.